Get ourselves underway. My name is Jonathan Jones. It's my pleasure, my privilege to be the moderator for this afternoon's discussion. We are talking about where micronutrients and medicine meet. And this is part two of our discussion. We had a very nice discussion with Dr. Prasad just 2 weeks ago, and it was quite enlightening. But we want to follow up on our discussion and share some spotlighted information with you, because it doesn't matter who we are. If you're taking any kind of pharmaceutical medication, you're curious about not only the benefits of it, but what if there is a two-edged sword to it, if there is something that you need to be concerned about, you want to know about that as well. I mentioned, like, for example, last week, I had one gentleman that I was doing some volunteer work helping him out. He was in a very difficult and dark episode in his life. But as I was helping him, I noticed he was taking a particular medication every day, and I asked him what it was for. And he explained what it was. It was just something very simple. It was albuterol. So very common asthma medication. And I asked him if he was aware that there may be some side effects. So he says, no, the doctor said I need it, so I just take it. I said, well, maybe next time you go to the pharmacist, just ask the pharmacist to give you an information sheet about it, and then read about it, just so you're aware. That's all. Not that you have anything to be concerned about. Just make yourself aware of what's going in your body and what potential impact it could have on you. Because if something is going on, that wasn't happening before, you may not necessarily connect it with this new thing that you've introduced into your life. So he said he did that. And about 2 or 3 weeks later, he came back, maybe the next month or so, and he was screaming. He says, I did that. I asked the pharmacist for an information sheet, and I started reading that thing. And one of the side effects it said on it was death. And it was, of course, a rare side effect. It's not something that would happen under all cases. And I think he also mentioned, I think I read it later also, that it said after prolonged use. So it would take a long time before that could happen. And there's reasons for that. In fact, I'm going to maybe share some of the reasons why it's possible that there could be some extreme adverse side effect to a particular pharmaceutical remedy. So we'll talk about that a little bit. But he was just blown away by the possibility that something he was taking could be potentially causing a serious problem for him. So anyway, before we begin our discussion, we do need to tell you that the FDA has not evaluated these statements, and you're going to be hearing some testimonials potentially. None of them are rehearsed. We don't rehearse testimonials. We just let people express themselves however they like. And you should know that results are atypical. That means that what happens to one person may or may not happen to you. Neither the Healthcare Support Association of America, Engage Global, Dr. Prasad, Jeff Ashby, none of the host or co-host, Jonathan Jones, any authorized representative of these companies make any claims that any supplements that we recommend will treat or cure any disease state. This presentation is for information and educational purposes only. It is not intended to be a substitute for a visit to your doctor. We strongly recommend that you seek the competent medical advice of professionals that you trust. So this is for information and educational purposes only. So why do medications matter? They save lives. Very simple. There was a time when there was no such thing as insulin for diabetes. And it was a slow, painful, agonizing death. A person would just become more and more emaciated, because if your cells are not absorbing glucose, you are literally starving to death, because glucose must penetrate into the cells, and a person must be able to absorb that for energy's sake. Insulin, if your pancreas isn't producing it, is the key to allowing the glucose to go into the cells. So prior to the discovery of insulin that could be sourced from, there's a number of sources. I think they can synthesize it, I believe, but it's from natural sources. It comes from pork and other sources. But prior to that, it was just a painful, slow, agonizing end for the person. Similar with the onset of antibiotics, a person could cut themselves shaving, get a little infection, and because there were no antibiotics prior to the discovery of penicillin, was the beginning of it all, then you could die. You could die from a simple infection. So there's no question that that medications make a difference in people's lives, especially when there's a chronic condition. And you'll notice that on our slide here, it says from hypertension to mental health. And so hypertension is one of the most fundamental chronic conditions that folks are dealing with. And there's no there's no particular, there's no racial divide, there's no ethnicity, there's no gender specificity, there's no economic, social class that's immune to it. It can happen to anyone. But medications address all of those potential conditions. However, there's a downside. There are possible side effects that just simply cannot be avoided, and they are inevitable. We put the caveat in here that they're manageable. And generally speaking, and if there's any doctors in the room now, please speak up and raise your hand. But for the most part, the way that side effects are managed is with another medication. So a person can be taking a medication for one thing, and then the doctor says, okay, well, we'll give you this to deal with that. And then if you look closer enough, you'll see the potential side effects of this new thing. And then sometimes there's a need for another medication to address the side effects of that. And then, of course, it goes into a vicious cycle. My mother-in-law, for example, this goes back about 10 or 15 years. I still remember when my wife and I began to be involved in managing her health. She was probably at that time right around 80 years of age, and she was taking about a tray full of medications. It was about 15 or 20 different medications. And my sister-in-laws, they went on vacation, and it was a pretty complicated procedure. You know, it's hard to step in and all of a sudden just take over managing someone's health. So we put the whole thing on a spreadsheet and had little check marks so that we could say, okay, this one was taken at this time, check it off, and put a date on there and a time, a signature, who did it, you know, so we could keep track of it carefully to make sure that she got all these medications in at the right time. But, you know, little by little, focusing in on a lot of Dr. Prasad's formulas, my mother-in-law now is down to maybe 2 medications at most, and she's 94. So from age 80 to 94, she's taking less medications at 94 than she was at 80. And she's doing much better with that because, again, there's no proof, there's no evidence that any of those things were creating side effects. But I can tell you that my mother-in-law's doctors have made it real clear that if there is a side effect to be had, my mother-in-law is the one that's going to get it. It could be 1 in 25 gazillion billions, and only 2 people in the entire universe will ever get it. Well, my mother-in-law is going to be the one that will have that side effect from it. And I'm exaggerating a little bit there, but that is what the doctor basically said, is that she's highly sensitive to just about anything and everything. Similar with my wife. My wife seems to have inherited a lot of the same traits as her mother. She will react. If there's a possible reaction that will take place, my wife is the one that will have that reaction. So we're extremely careful about what goes into her mouth and in her body. That's one of the reasons why we're so focused on this kinds of things. So you'll see it on the package. Very common pharmaceutical warnings: dizziness, fatigue, nausea, stomach issues, muscle weakness, and joint pain, all kinds of things like that. But I thought we might drill down on 1 or 2 of them this week, just so that we can have an idea of what it is we're talking about. Would you guys do me a favor? If anyone is taking medication for, say, high blood pressure, would you raise your digital hand, please? And if you're taking medication for high blood pressure, or if you know someone, maybe in your family, that's taking medication for high blood pressure, just raise your digital hand. And just so we can kind of see that. Maybe, Jeff, if I I can't see the total, but if you can just do a head count there, that would be very helpful. But here's one. This is I went and did a search and found out, oh yeah, 13. I got the total there. That the three most common medications for high blood pressure is, well, this is one of the top three, lisinopril. Lisinopril, and it works by relaxing the blood vessels, blocking angiotensin 2 from forming. That's a good thing if you're having a problem with high blood pressure. That's one of the things that you would want to maybe ameliorate if at all possible. But common side effects: dry cough, elevated potassium levels, low blood pressure, kidney function impairment, angioedema. Now, I don't know about you, but I can say this. Your kidneys are a very important factor when it comes to high blood pressure. So I'm not sure to what degree they're indicating that this blood pressure medication could potentially cause kidney function impairment. I don't know. I can't claim to be a scientist and have any in-depth knowledge on that. But I personally, if I was taking this, I would want to ask my doctor the question. Because again, remember, one of the root causes or contributing factors to high blood pressure begins in the kidneys. So, and it just reminds me of an article, I think it was in the San Francisco Chronicles. This goes back about 10 or 15 years. And the article said diabetes medication can cause diabetes. And I thought that was kind of strange. But what it indicated was the rationale was that taking diabetes medication does damage to the pancreas. But the average person is going to reason, well, my pancreas isn't working anyway, so what difference does it make? Well, that would be true if the pancreas only produced insulin. But there are literally hundreds of other functions that the pancreas actually performs that's beneficial to the body. So that's not necessarily a good thing. You really want to make yourself aware of what could potentially be going on. So, and again, I'm not trying to say that this medication is bad. So I'm certainly not trying to say that at all. If your doctor prescribes it, please, folks, do not make a decision to stop or discontinue any medication you're taking based off something you're hearing on a Zoom or a YouTube broadcast. Don't ever do that. You make sure that you speak with the doctors and medical professionals that you trust. Another one, this is the number 2 most common treatment for high blood pressure. This one, amlodipine. It works by relaxing blood vessels, inhibiting calcium ions, and looks like the text got mixed up there. How it works is mixed in with the common side effects. So kind of flip that around in your mind. Move how it works up to the top. So, but some of the common side effects are edema, that's swelling around the ankles and the feet. And I think we've all seen maybe individuals with swollen ankles and swollen feet, flushing, dizziness, fatigue, palpitations, irregular or rapid heartbeat. Now, I don't know. And once again, I'm not in the least bit trying to say that this is not something that anyone should take, because God knows that if your doctor prescribes it for you and it's going to be beneficial to you in managing your hypertension, that's certainly something that you should listen to your doctor about. However, you may want to ask the question and make yourself aware that if you're starting to have heart palpitations, is that the time that you should talk to your doctor and maybe do something else to try to ameliorate that? If you are having swelling and any edema or any symptoms like that, is there something that can be done to help your lymphatic system function a lot better? Just make yourself aware. And again, these are just the common side effects. We're not talking about the rare side effects like the ones that my mother-in-law would experience, or that my wife would experience. These are just the common ones. And so the rare ones, I shudder. The last one that we'll just mention just really briefly here, metoprolol. I don't know these, so I don't take these medications. So that's why it's a little bit of a challenge for me. But again, this one works by reducing heart rate and force contraction to lower the blood pressure. Common side effects, as you can see, still listed there. Fatigue and dizziness is all mentioned. So if anyone is having fatigue issues, it's not necessarily your fault. It could just simply be, par for the course. It could simply be one of the consequences of making sure that your blood pressure is under control. But it can cause cold extremities in the hands and the feet and shortness of breath. It can cause a slower heart rate as well. So these are all issues that could come into play. And I find it very odd sometimes when I hear of individuals, and Jeff, maybe if you don't mind chiming in here for a second, have you ever heard of someone maybe beginning a regimen of, say, some of Dr. Prasad's products, and they somehow become more aware of certain things that they're experiencing, and they think that it's Dr. Prasad's formulas that may be contributing to the product? Have you ever had that happen? Okay, we may not have Jeff, but I've had that.
Yes,
Okay,
it has happened, and it's a lot of times we need to verify and confirm with these individuals that are now beginning Dr. Prasad's recommendations and his regimen, that they need to discontinue all other supplements, not their medications, but other supplements. I've had that be the contributing factor, much more than the prescription medications, which work on an entirely different system in the body. And Dr. Prasad has described that to us. We're approaching it from a nutritional standpoint, and oftentimes it's the other supplements that are creating the negative outcomes
right.
versus Dr. Prasad's products, which work in harmony or in concert with the prescribed medications.
Excellent. And one of the things that I think that you and Dr. Prasad have mentioned is that one of the things that his formulas will do often is ameliorate some of the side effects of the medication. So we'll talk about that in just a minute. Maybe you can even describe some of that as what you've seen in that respect in just a couple of minutes. So here's the thing that stays in and should be in the back of the mind as to the reasons why some of these things may take place, folks. And it's as you can see on the screen, I'm trying to move a few things out of the way. Medications leave byproducts in the body, and that's called metabolic waste. And this, of course, is not things that's ever spoken about. And again, we're not saying just because this happens that you should discontinue taking your medication. So please don't ever get that impression. But over time, this toxic load can weaken organs and immune defenses. Chronic conditions increase oxidative stress, and that compounds the problem. And here is where the rubber meets the road. Micronutrients, on the other hand, neutralize free radicals. Antioxidants can reduce oxidative stress, support detoxification. So they actually can help the liver and the kidneys remove waste. Micronutrients, like in Dr. Prasad's formulas, boost cellular repair. These vitamins and minerals restore tissue damage, potentially, because we're talking about nutrients that can actually help the body to feed itself. And they work synergistically, as you just heard Jeff say. Jeff, by the way, is one of the ambassadors with Engage Global, and I'm sure that many of you are very familiar with Jeff. He's hosted this program on Sundays as well. So again, he has a storied history with Dr. Prasad and the company Engage Global, with literally thousands of individuals impacted by his and his wife's efforts. But they work synergistically with medication, improving the effectiveness of the medication. So This is where I call this the happy slide because this is the one here that helps you to appreciate and be motivated to step forward and give some consideration to doing something in consort with what your doctor has recommended. I gotta go, just gonna back up to my mother-in-law for just a second before I tell you a little bit more about Dr. Prasad. But my mother-in-law reached a point where she was experiencing something, and I think it had to do with stenosis or sciatica or something like that. No, I think it was her digestive issue. But she went to the doctor and was pleading with the doctor to give her something to help her with this situation she was dealing with. But my mother-in-law's doctor was just very hesitant to, and even now they're at the point where they're like, there's nothing else that we can do because you're allergic to everything. You're too sensitive to everything. So we can't do anything. But this goes back a number of years now. But she said to my mother-in-law, doesn't your son-in-law have something that you can take? So, I mean, I just kind of chuckled. And so sure enough, my mother-in-law called up and says, what can I do for such and such? And so with in discussion with people like a Dr. Prasad and others, we were able to come up with some natural things that could benefit her and ease her her situation. And to this day, my mother-in-law is still taking copious amounts of Dr. Prasad's formulas, almost all of them, and she's benefiting from 94 years old and counting. And by my estimation, she's going to make it to about 110. So at the rate that she is going, and we're very happy to see that happening. So the man who's behind had been referred to as the godfather of micronutrients is Dr. Kedar Prasad. Brilliant man. He was the world's first radiation biology PhD. He was also a professor at the University of Colorado School of Medicine for more than 30 years. His products have been awarded more than 10 U.S. patents on micronutrients. So he's been around the block a few times. Among the many things that's mentioned here, one of my favorite ones is the fact that he discovered the anti-cancer potency of vitamin E succinate. And he also is the scientist that's credited with discovering that butyric acid is an anti-cancer agent. So out of the hundreds, thousands, maybe even millions of scientists out there, he came up with somewhere in the area of, well, it says here he's been published 250 times, but I think it's closer to 300 times that he's been published in peer-reviewed public articles. So that means his brain has never stopped working. In fact, just recently, this past year or two, he has been published yet again. And we're going to be talking probably in the next couple of months or so about his published work on anti-aging. He just gave a conference, I believe it was over in India, where he was featuring his research on anti-aging to a group of doctors and scientists. So this man is quite brilliant, and we are the beneficiaries of his work and his brilliance. We have access to that. So if you are in the least bit concerned about side effects, you're in the right place. And I'm assuming that you are, because you're here on this program today. And the number is continuing to rise. You have 64 connections on right now. But here's just a little bit of a cliff note about Dr. Prasad's breakthrough formulas. We're talking about high potency antioxidants, trace elements. And these are all essential ones because selenium, I'm not sure if you're familiar with how beneficial selenium is, but it's generally speaking, it's just not in the soil anymore. In fact, a lot of the food that is grown in the soil is completely depleted of selenium. I remember giving a lecture once to a group of people, and there was a man that was sitting right on the front row, and his face seemed to change when I talked about the fact that there was no nutrients in the soil anymore. He almost went flush white. It was visible that I could see this man's face change. I said, "Oh my!" I said, "What's wrong with you?" He said, "How did you know that?" I said, "How did I know what?" He said, "How did you know that we only?" He says, "I'm one of those people that my job is to spray the nutrients back into the ground after a crop has been yielded. How did you know we only put back in like 10 or 15? I forget what the number was. And the crop is taking, 20 or 30. How'd you know that?" I said, "Well, it's just public knowledge. You just do the research and it's out there." He said, "Well, it's true. And we know, and I know it, that we're not putting in everything that the crop is taking out of the soil." Because remember, back in the day, there used to be a thing called crop rotation. And we were all taught that in school, that you grow a crop here, you put it on this crop, because each crop takes a certain thing from the soil, and certain crops put certain things back. And every so often you let the land rest so that it stays nice and balanced. Well, that's not the way it works anymore. So that's the reason why the food that we eat today has almost no nutritional value. In fact, your grandmother, your great grandmother, she lived back in the early 1900s. I guess maybe your great great grandmother of mine lived back in the early 1900s. She would have eaten an ear of corn that was so nutritious. For you or I to get the same level of nutrition from corn today, we'd have to eat between 18 and 20 ears of corn right now to get what our great grandparents got. Whoever lived back in the early 1900s, we'd have to eat 18 to 20 ears of corn to get the equivalent. So we're not getting the same level of nutrients from the food anymore. And then the additional proven benefits of Dr. Prasad's formulas is reducing oxidative damage, oxidative stress, improving energy levels and resilience, minimizing common side effects like nausea and fatigue. So if you don't get anything else from this discussion, we're going to share a couple of testimonies with you. In fact, I'm inviting you, especially if you've had any benefits with your blood pressure in particular, because that's what we're focusing on with the side effects here today. From Dr. Prasad's formulas, we're going to want to hear from you. So just go ahead and start getting yourself warmed up. And this is all just leading into that moment where you get a chance to just tell us a little bit about the benefits that you've had. But you see that, there it is. Dr. Prasad's breakthrough formulas have been proven, one of the benefits of it, minimizing common side effects like nausea and fatigue. So the flagship product today is this one here, Micro Daily. And this is the Hydro EMF formula. So this is the one that is the most advanced formula that Dr. Prasad has produced. It still has all of the base ingredients from the original MMF. That's the military micronutrient formula product that Dr. Prasad designed for the United States government, the military. Only this has 4 additional ingredients to help the body to deal with the onset of 5G radiation. So it's a very, very powerful and beneficial product, and many folks are benefiting from this. So let's see if we can't take a minute or two and hear from some of you. Go ahead, just raise your digital hand if you'd like to share your story about your experience with blood pressure specifically, and having maybe dealing with some of Dr. Prasad's formula. In fact, we're going to show you a picture of the latest product that Dr. Prasad formulated. It's called Heart Boost. We'll show you that in a moment or two also. So Horace, you want to share with us your high blood pressure story? Is that what you're going to share with us now?
Yes. I had a blood pressure problem. My blood pressure was very high. It was always high. It was never low. And it was always in the 40s, 50s, over 80, somewhere in that neighborhood. And the doctor said, well, because of a person your age, that's kind of normal. But that scared me, because sometimes when I laid down and went to sleep, I could actually feel my heart pumping, and it would go boom, boom, and I would actually move. It would actually move my head. It was pumping so hard. So to them, that was normal for a person my age, but I didn't want that. I wanted to have my heart beat calmly, and so I could sleep at night and not have to worry about it. But anyway, I started taking the micronutrient products. I started taking the Micro Daily, and then the Hydro. What I did, I took the original. I would take 3 original along with a micro Hydro Boost every morning, plus the probiotic and the omega-3. I did that for quite a while. The blood pressure started to come down some, but it still didn't come down enough. When I started to take it, they put me on these different type medicine. I went to 3 different type of blood pressure medicines. The first one was not quite strong enough, so they made it a little bit stronger. Then the second one, they said, well, this is not working. We'll put you on another one. So they did. They put me on 3 different ones. And so they said, okay, with your age, they said, it affects your kidneys and it affects your liver. So we want to make sure that you're okay. Well, by taking the Micro Daily products, when I went to Myrtle Beach to the cardiologist there, and they checked my liver and my kidneys, They said I was asymptomatic. I did not have any symptoms at all. So they said your liver is great and your kidneys are great. So you're not having any effects. And they said that's rare in a person your age. You know, we're looking for somebody that's dragging, somebody that has no energy. He said, well, I'm looking at you and you got all of that. He said, you're really healthy. Well, when the heart boost came along, I jumped right on that too. So now, after taking the heart boost for about 4 months now, all my blood pressure has leveled out. It's usually 137 over 80, 135 over 80, somewhere in that neighborhood. And because I have a pacemaker, my bottom level stays at 60 all the time. So the micro daily products truly do help, and especially if you take them as Dr. Prasad prescribed them for you.
Wow. Wow. So you're so your cardiologist was surprised you weren't having the expected or anticipated side effects.
Exactly. And that's why they rushed me to Myrtle Beach, because they wanted to make sure that the medicine that they were prescribing for my blood pressure did not affect my kidneys or my liver. And when I got there and they did the checking, they found nothing. They said my liver was good and my kidneys were excellent. So the micro daily products, they are awesome products, and me and Bev would never be without them.
Now, you were familiar with those three high blood pressure medications we talked about at the beginning?
Yeah, I'm familiar, although I didn't take them. Yes, I'm familiar with them. And so, yeah, I know what they can do to your liver and to your kidneys. They can wreak havoc with them. And those side effects, if you're not taking something like our micro daily nutrients, then you'll be tired, you'll ache. Like I had lymphedema so bad that my ankles and legs swelled up, and it felt like you could take a pin and they would just burst. They were so tight and they would shine when they swelled up. Now my ankles and legs are normal. I don't worry about the swelling up or anything like that. They're normal because of the micro daily products.
Wow. Yeah, well, I would have to say Dr. Prasad, his brilliance has really manifested itself in your case. So thank you very much, Horace. We
Quite welcome.
appreciate your sharing your story there. Wow. I'd say that kind of illustrates the story quite nicely. Jeff, does it surprise you when you hear these kinds of the results that Horace just mentioned?
You know, it's really not surprising with as many three-way phone calls and Zoom meetings as that I do throughout every week. It's this kind of response that people are really looking for. You understand that Dr. Prasad's nutritional support is the way that he views it, and then we look for the body's response versus going after a cause and seeking a reaction from forcing the body into a particular reaction, not a response. And so I can't imagine, as Horace was describing, how swollen his extremities were and the difficulty that must have been for the body to be able to circulate blood into those extremities, where he says it swole up so much you felt like you could, pop it like a balloon with a pin. And we know that that's not the case. That's just stuck. Just the body was not able to get the circulation out of those areas because it couldn't get into those areas. So when you're adding a nutritional support like Heart Boost, it produces or supports the body in vasodilation with like beetroot, with like citrulline, some of these things that just support it naturally. Yeah, go ahead, Horace.
I just wanted to say, Jeff, that about the ankles and the leg, they were swelled up so tight. Sometimes my feet felt like they were locked into place. I couldn't actually bend them up and down like that. They were just locked into place. And so I felt walked like a person that, what do you call that? Mechanical person. the way I walk from time to time because I couldn't
Like a
actually
robot.
bend right like a robot.
Let me find my book now.
I couldn't bend my feet. They were swelled up so bad. And it was like that every day. At night, when I laid down and went to sleep, they would go down some. But the minute I got up and started taking a drink of water or something like that, they would swell right back up. And they stayed like that all day long.
Wow. That's
It can be healthy.
no,
Yeah.
that puts a huge amount of pressure on the circulatory system. Looks like your better half has an additional comment here, Horace. So go ahead, Beverly.
My situation, can you hear me?
Oh yes.
My situation wasn't as expressive as my husband's. But anyway, I had high blood pressure due to treatment that I was getting for my back. I was getting injections in my back because I had an accident, and that brought on the high blood pressure, diabetes, and all kinds of other complications that I developed. And I'm saying, where did this all come from? And it was all sudden. But thankfully, my husband heard about Microdaily and he jumped right on it because he's always saying when he saw me come in the afternoon, he wanted to cry because I was in so much pain. So he was going to do whatever it took to help me. And believe it or not, I have one of those doctors that I don't think that she believes in micronutrients or whatever, because I'm telling her I'm going to start taking this because nothing else is working. I feel like I'm going downhill. All of the medication that you're giving me is making me sicker. So when we started taking the microdaily, that was, believe me, a godsend, because I immediately started to feel better. I go for my checkups and my doctor is saying, whatever it is that you're doing, just keep doing it. I don't know, maybe that medicine is really working, she says. And so at that time, I just kept on taking it. And then it got to the point, believe me, she had no choice whatsoever but to take me off of it. So I'm on no medication, prescribed medication at all. I
Wow.
take Microdaily, and that's the only thing that I take, and it works for me. I am practically out of pain, still have a little back problem, but practically out of pain. And it is really a wonderful feeling to not be in pain like that. Pain can drive you to be an ugly person, an awful person, because you're gonna express yourself and in a negative way. And I'm not a negative person, but
Right.
that's what pain does to you. So I'm very thankful to Microdeal, to Dr. Prasad, to you, Jonathan, to Bernard, all those who have been encouraging to me in taking these products so that I could feel better. Thank you.
This is it's wonderful to hear. But just wanted a little follow up on what you said here, because folks need to kind of get the whole story here. We love hearing about the positive benefits and the positive results, and it's heartwarming. And you can't help but bring a tear to your eye. And you know, and your husband's heart is just beating there. He's just oozing with love. And I get that, because you know I've worked long and hard to try to make sure that my wife is alive, and I credit, you know, finding the right combination of micronutrients with keeping my wife alive now, and her mother. So I'm convinced of that. But you mentioned something. You were being treated with injections, so that would be what, epidurals?
Okay, let me go back, because see, this is something that the medication and the injections do to you. They mess with your memory. A lot of times I couldn't remember what it was that they were giving me, but it was, I believe it was steroids. Is that it?
Yeah. Yeah, an epidural is usually an injection of steroids in the back
Okay.
to reduce the inflammation.
Right.
And I'm trying to highlight this because my mother-in-law was having extreme pain, and the doctors were giving her injections. And years later, after battling diabetes, the doctor said to her, well, it was the steroids we gave you that caused the diabetes. And
Exactly.
you're now another person that says that you experienced the same thing.
Yeah. And it was so sudden. I mean, I didn't have health issues like that. And then all of a sudden I come up with all of these different things. I'm saying, how does that happen? In 6 months' time, I've got diabetes, high blood pressure, high cholesterol, and just all kinds of things going wrong. My legs wouldn't work. I couldn't hardly walk. They give me the injections and say, this is supposed to help you. But I couldn't do anything after the injections, which was supposed to help me.
Okay.
And then I had all of the side effects to go along with it. I was just, believe me, it made me a terrible person. And
Okay.
and you know, your mental, it does something to you. And that's not people who know me. Donnell, who knows me, that's not the kind of person that I am.
Oh, yeah.
But that's what it does to you.
Oh, yeah. And it's important to know this because, again, there's folks on this meeting right now knowing that this discussion was just going to be basically featuring, the benefits that micronutrients could have when it comes to ameliorating side effects. And the two of you are living examples of the proof, just that it can happen. And again, as we mentioned before in our disclaimer, testimonials are purely anecdotal. What happens to one person may or may not happen to you. But we're happy to hear that it happened to you. That your side effects were mitigated because you chose to use Dr. Prasad's formula. So thank you very much again for both of you for sharing your stories with us. Wow, Jeff, I don't know. I don't know.
That was a lot of fun to have the cooperation between husband and wife that are both observing things in the other's experience that they may not have completely realized or understood themselves. It definitely demonstrates, as we started out this call, the importance of family and
Yep.
how we are here to truly help each other, bear one another's burdens, and kind of be on this journey we call life together. So what a great example of that, you two.
Yep, 100% agree with you. Tell us a little bit about this heart boost, Jeff, because there are people here who right now are saying, is there anything that can help me with high blood pressure? And of course, we are in no way making a claim that this is going to help with high blood pressure, but how can it help the body as they're dealing with these issues?
Well, as I was stating earlier, Dr. Prasad's formulations are designed to support the body from a nutritional standpoint. And just referencing a couple of the ingredients there, in fact, I have one of those ingredients. I thank you for sharing the information with me, and that is the beetroot. If we go back into the old where do you the Colosseum fighting when they had, Spartacus and the gladiators going at each other. Only those performers were allowed beetroot powder or the extractions from beetroots because they realized how much more effective they were at the entertainment. Fights would last longer. They were able to sustain energy throughout it. And that's just one ingredient of Dr. Prasad's incredible formula here. We've got another one that I referenced earlier, citrulline. It's derived from watermelon, and citrulline has the ability to go in and do a vasodilation. I mean, change the body's ability to flow blood through our pipes. And if you look at just two of those incredible ingredients, it'll demonstrate how Dr. Prasad's formulas are supporting the body from a nutritional standpoint, and it is the body's job to respond to those. And so it is doing things like I mentioned, increased circulation, better pressures, just all of those things that go along with our discussion today. So,
Are you
and,
aware
and,
of
and
are you
yeah,
aware
I
of
was
any
going to
side
say,
effects?
what was that?
Are you aware of any side effects of this?
No, that's just it. It is food. It is food. In fact, even right there on the little advertisement, it says take with food and take twice a day, because our bodies are designed to uptake nutrition, and as this nutritional support, we want that nutritional stockpile to be available for the entire 24 hours that we all enjoy in a day, not just a one a day approach or going after a particular cause and seeking the body to react. We are, with Dr. Prasad's formulas, supporting the body's response from a nutritional standpoint.
That's a beautiful thing. And the benefits that you mentioned of just those couple few ingredients, very similar to the mechanism of action or the intent of the pharmaceutical drugs that was mentioned, to improve circulation and cause the blood to flow more freely and through the circulatory system. So that's you can see how this could be synergistic and it could all work together to improve the overall situation. So very good. Thank you, Jeff. That's extremely helpful. We got Betty Grimes that is in a position to share her story as well. So Betty, if we can find you, we'd like to either bring you up on the screen or just go ahead and unmic yourself and just start talking.
Okay, can you hear me?
Yes, we
You
sure
find
can.
it? Okay. Yes. I thank God for these micronutrients. Over 2 years ago, we started taking the product for protection against 5G. And my husband, who had been having pain for over 12 years and walking with the cane, started taking the supplements. And before that, we were putting pain relief lotion on his back every night and every morning. Then a few days after taking the product, he said, I don't need the pain relief lotion. And he put the cane down, no more pains. That was a miracle. But recently, I experienced my own miracle. When the heart boost came out, I took it. In a few days, I looked down at my legs and they were smaller. And it's like, what happened? Because I always thought that I had fine looking legs. I had nice, healthy looking legs. But what it was, I had edema in my legs and did not realize it. So you can imagine if we can see something on the outside, what's happening inside our bodies that we don't know what these micronutrients are doing. But anyway, my blood pressure, I had always had problems with high blood pressure. My blood pressure came down to 120/74, and it is staying in that range. It is a miracle. Thank you.
My goodness, you said 120/70?
Yes, sir.
And would you mind telling us how young you are?
78.
That's the blood pressure of a 20-year-old.
Yes, it is. Thank you.
Congratulations.
Thank you.
That's absolutely beautiful to hear. Thank you very much for sharing
You're welcome.
that story. At 70, I think my blood pressure is right in that same range, 120 over like 70. And I did hear the doctor say, "Oh, one of the lucky ones." I said, "No, this is not luck. This luck has got nothing to do with this one." But that is so
Give
beautiful
the
to hear.
body what it needs, it will heal itself.
That's right. That's exactly it. So thank you very much for sharing your story. So there you have it, folks. I mean, what can we say? And Dr. Prasad's brilliance is what makes this all possible. So just real quickly, so that you all can have an idea, especially if you're here for the first time, the way to go with this is to select one of the bundles and then to build on from there. So if you really want to get yourself into a better place nutritionally, select one of the bundles. You select one of the bundles, and then if you want to add on any of the Boost products, you get discounts, from there. So just speak to the person who invited you, and they'll help you to do that. On the very, very minimum that you want, though, you want to start with the basic bundle. That's the least that you want to do, is the basic bundle, and then you can just add on the heart boost, especially if you're focusing in on some of the issues that we're talking about today. And that combination by itself will help with the side effects of a huge percentage of the population right now. Because I saw the head count was somewhere around 1/3 of all the people that are here on this meeting today that are either taking high blood pressure medication or have that in their families' lives. So that was at least 1/3 of the number that's on this meeting that that's dealing with that issue. So the basic bundle and add on the heart boost. Now, I think the heart boost, whatever the wholesale price is, if you get this on subscription, you get the discounted price for that. And when you add the heart boost on, they'll give you an additional $10 discount below the wholesale price when you add it onto this bundle. So just make sure that that's the way that you do it. Subscription with one of the bundles and then add on the boost. But you got to do that over the phone to get that additional discount. The premium bundle is off the Richter scale. The Core 4 is the absolute best. And we don't have time to go into the details in discussing all of the reasons why the Core 4 is the best way to go. It's only $200, and it's actually the discount on that is just insane. But that is, in my opinion, the best way to go. The more bang for your buck there. But this is the basic bundle. You get it for $110. It might be $2 or $3 more than that now. I may have some old prices here. There's the collagen. This is the omega-3. This is the digestive boost, CBD boost, the brain boost. I cannot live without this stuff right here. So I take that every single day. Sleep boost. You want to go into la la land at night, add that sleep boost to your regimen, and you'll see what happens. But there it is. There's the Core 4 when it comes to dealing with side effects. The retail cost $310. The discounted price is around $200 if to get that entire bundle. If you were to buy that, even at the wholesale price for each individual piece, it would be somewhere around $250, $260. So just for the wholesale price. But Engage Global is subsidizing our health, and they want everybody to have it affordably so. So you just add on the shipping and the taxes for your area, and that's the only additional cost that you would pay. So these are the bundles. Take your pick and improve your health. Just whoever invited you to this meeting, they will be the one that you will talk to, and they will help you to put the bundle together that works best for you. But the last thing we want to say as we wrap up this discussion is get moving, folks. Don't demand from your doctor, from a potion, lotion, or pill, what you could do for yourself. Not enough can be said about getting moving and change your relationship with your couch. Get out, get walking. We don't expect you to do aerobics. We don't expect you to go out, doing any bungee jumping or anything crazy and running any 5Ks or anything like that. But if all you can do is walk, please just walk. Try to get in somewhere between 5,000 and 7,000 steps per day. It's only 3.5 miles. And you can get that sometimes just by going to Walmart, but don't park all the way in the front, park at the other end of the parking lot as far away as you can. Get those steps in and get yourself moving. You will be amazed at the mental faculties will improve, endorphins will get better, everything in your body will get better. You feel better because you're moving. Our bodies were designed, engineered to be in motion. So that's what you can expect. So next week we will have another discussion next week, and it will be a follow-up on our discussion on side effects. So you will not be disappointed. If you do have guests who need to hear a presentation like this, don't worry, they will be able to get a presentation. We will be very, very happy to make sure that they get some education or some training that will be of benefit to them. So for the record, again, we strongly recommend, just please keep in mind that this is for information and education purposes only. None of these comments have been evaluated by the FDA. Nothing here was intended to be a substitute for a visit to your primary health care physician. We strongly, strongly, strongly recommend that you seek the competent medical advice of professionals that you trust when it comes to making decisions about your health and your well-being. So my name is Jonathan Jones. It has been my pleasure. this afternoon. Thank you, Jeff, very much for your co-hosts, Horace and Beverly. Donnell, thank you very much for your stories. Betty Grimes, thank you so much for sharing your stories. You guys are wonderful. We'll see you next week.